The health and financial impact of COVID has hit Americans hard, especially the Hispanic community. And those who are essential workers bear the brunt of the pandemic, working frontline jobs or taking care of someone in their family who is. But when you're feeling the tension, how do you know if it's stress or something more serious? Joining me this morning to discuss are Dr. Monique Jimenez, an American Heart Association volunteer medical expert, and Claudia Mercado, a two-time heart attack survivor. Good morning, ladies. Thanks so much for joining us.
Good morning.
Doctor, why are Latina essential workers at an increased risk for a heart attack?
Latina essential workers are at an increased risk of experiencing a heart attack for several reasons. And we know that COVID has disproportionately impacted the Latino community. We see higher rates of infection and higher rates of death from COVID-19. We also know that Latinos are more likely to be essential workers and may not have the luxury to engage in physical distancing. And women might be under an incredible amount of stress, as many people are during this time. And we know that when the body is under stress, that can lead to other bad health outcomes like increased blood pressure and problems with sleeping, in addition to weight gain and heart disease. And these can all increase a woman's risk of having a heart attack.
Yes. Now, Claudia, you're a two-time heart attack survivor, incredible, and an essential worker. Can you share your story with us?
Of course, I'm very excited about that because I want all the women to recognize the risks and the signs about heart disease. Because with my first heart attack, I was oblivious to them, of the chest pressure, the back and the arm pain. I was thinking I was having indigestion. Later on, 5 years later, when I had my second heart attack due to stress, I recognized the symptoms. And that's my mission as a real woman with the American Heart Association, to pass this knowledge so other women know the risks.
Yes, absolutely. So, doctor, what are the signs and symptoms that are specific to women?
Absolutely. It's incredibly important to recognize those signs among women for a heart attack. And it's important to remind everyone that cardiovascular disease is still the #1 cause of death among U.S. Latinas. And so men and women present with different signs often of a heart attack because there are biological differences between men and women. And for women, the presentation may be pain in the jaw or pain in the back, also nausea or shortness of breath. And recognizing that these could be the signs of a heart attack is incredibly important to seek care urgently. And the Go Red for Women campaign with the American Heart Association recommends that women begin to get screened for cardiovascular risk factors as early as 20 years of age so that they can understand their risk factors for cardiovascular disease and having a heart attack, and have those conversations with their healthcare providers.
Wow, yes, I never would have expected to start screening at 20, but good advice there. Now, Claudia, how are you managing your heart disease today?
Well, the first thing is to have a regular doctor. I didn't have one before of this. I keep my appointments every 3 months. I learned how to eat healthier and to be more active. I walk a lot, and that helps me with the stress. Also, keep my positive. I do a lot of lists with the positive things that I have in my life. And I do a little art that helps me a lot with the stress.
Yeah, very good. Doctor, do you have any other advice you would like to give for women living with heart disease?
Absolutely. It's important for women who are living with a history of a heart disease to understand that they're at increased risk of complications from COVID-19. And it's also important to remember that heart attacks don't stop just because of COVID-19. So recognizing the signs of a heart attack and of a stroke is incredibly important to getting urgent care. And we want people to know that the hospital is the safest place for you to be if you're having signs of a heart attack. And please do not delay in calling 911. And if people want to learn more about the signs of a heart attack or how to manage their risk, they can go to heart.org/nuestras historias.
Okay, well, thank you so much. It was wonderful to hear from you both today.
Thank you so much.
Thank you so much.
All right. Remember, even modest changes to diet and lifestyle can lower risk as much as 80%. For more information, visit the website on your screen. And thanks to the American Heart Association for shedding light on this issue.